What's up guys, Pat here back with another hip arthroscopy video. I am currently sitting week 6.5, 7-ish. I know it's been a while since I've been posting on YouTube, so I've definitely been busy, but wanted to update all of you guys on my progress. So last time I had posted, I had just been getting back to walking without crutches, which was super exciting, and it really took off from there. So that was at about 3.5, 4 weeks post-operation. And since then, I've really made some substantial progress. I feel like the first couple weeks were pretty boring. I wasn't working. I was just kind of laid up on the couch. Now that I'm off crutches, I'm back at work, which is good to have some more structure in my day, as well as advancing more and more on some of the physical therapy exercises, which I'll post a little bit of a recap on what I've been doing in the latter part of this video. So I went back for my 6-week post-operation, which I went back to see the surgeon. There they just do an x-ray, and that's the first time they really scan the surgical area to see, I guess, structurally how things are looking. And really positive news from that x-ray, as I guess the big thing that they look for is redevelopment of the bone where they had to shave for the cam impingement, and that was not the case, which is great news. That means the modifications that they made are holding up. The body's not trying to reestablish that extra bone that was really causing the labral tear to begin with. So to me, it seems like I'm on track for a long-term solution, which will hopefully lend me getting back to the things I love, like running and exercising on a daily basis. I've added a lot of exercises to continue to strengthen the glutes, the quads, the hamstrings, and just gain more flexibility. I would say the biggest challenge that I've seen really from week 4 through week 6 is just that there's days where it feels like you've had a major setback, and that can definitely be discouraging. I know that when I wake up on those days, it's extremely frustrating because it feels almost like I'm back 2 weeks or 3 weeks in terms of progress. But it's important to stay positive on those days, to do a lot of stretching. That's what I've found has helped a lot. And know that you're gonna rebound, and there will be setbacks. I've been doing a lot of reading and looking through Facebook groups, and it seems like that's just a similar thing that happens to a lot of people, where what I've kind of summarized it down to is when I have a higher activity level day, so if I walk a little bit more than I normally would, based off my current activity level, or I'm doing just more physical activity or physical things at work, I tend to feel it the next day, and not necessarily in a bad way. I just kind of tighten up. I would say the biggest pain that you really feel is in the hip flexor area. And what I found really beneficial is that stretch of the quad, which kind of loosens up the hamstring jointly while stretching out the quad. So I found myself on those days doing that stretch for at least 5 minutes straight on the surgical side, like 2, 3, 4, 5 times a day, as much as necessary, as it does provide a lot of relief. And I would say in terms of just kind of pain on a day in, day out basis, it's from sitting in an upright position for a prolonged period of time definitely causes it to tighten up, which at work tends to happen sometimes. So I've been utilizing that stretch quite frequently to loosen it back up, and also trying to not sit for too long of a period at one time. Fortunately, with my job, it's kind of a mix of sit and stand, so able to kind of not get too stagnant, but not also be on my feet 100% of the time. So it provides a good balance where I'm able to keep moving, to keep things loose, but not too much movement to the point where it really causes problems. So that hip flexor stretch and the hip flexor and quad stretch that I'm referencing is essentially when you're lying on your stomach with the band around your foot and just over your shoulder, pulling that basically your ankle back to your butt and holding it there for 4 to 5 minutes, I find that when I get up after that stretch, the hip flexor is really, really loosened up. And from my understanding, it really seems like the hip flexor just tightens up because quite frankly, you've not been using that, and like any muscle, when you're not using it after not walking properly for weeks, sometimes months at a time, depending on how your recovery is going, naturally that's just going to tighten up and be very sensitive. So the more that you're able to loosen that up, that's the better you're going to feel. So on those days that I do have setbacks, I find myself reverting back to that stretch for relief, and it usually gets me back on track. In terms of my activity, so my physical therapist has been okay with me running. Just kidding. So I've been walking for short durations as tolerable outside, which has been really nice as the weather started to turn here in New Jersey towards the spring and summertime. It's really nice to be able to get out on those days and walk a mile or maybe 2, depending on how I'm feeling, at just a leisure pace, nothing too aggressive. No running yet, and a lot of biking. So I've been utilizing the stationary bike quite a bit at physical therapy, as I find that really loosens things up. And then when we go to look at flexion and external rotation, I find that after I've ridden the bike, it's a lot better. So I've been riding the bike pretty consistently 2 times a week at physical therapy. Sometimes I've been going to the gym to just ride the stationary bike there. Unfortunately, I don't have my own regular bike. I'm kind of looking into that right now because I feel like I really do enjoy it. And with the weather getting nicer, it would be nice to be able to get outside and ride. But ultimately, my goal is really to get back to running the distances that I previously was putting down prior to sustaining the labral tear. And no real traction on that yet, but definitely much improved on just overall day-to-day life. I really don't notice it unless I'm really stretching, bending down, sitting for prolonged periods of time. I would say I notice that it's there, but overall I do feel pretty good for being 6.5 weeks post-operation. So I'm scheduled to go back to my surgeon in about 2 months, I think, for one final evaluation. And I'm kind of looking to talk to my therapist over the next couple weeks to see about potentially getting back to some light jogging. So in the program, it kind of budgets that depending on how well your progression is going. So anywhere between, I would say, the 9-week mark all the way out to like the 6-month mark. But I feel like just based on how my progression is going, no pain in any of the PT exercises that I am doing, improvements in flexion and external rotation, I feel like I'm getting close to being able to at least do light jogging on the anti-gravity treadmill at the physical therapy place. So excited for that. I'll keep you tuned on how that's going. So next, I wanted to kind of dive into some of the PT exercises that I've been doing. Granted, I'm 6.5 weeks post-operation, 24 years old, very active. So I understand that for some of you watching this, it may be well far advanced. For others, you may be far ahead of me. And I think that's the important thing to take away from all this, is that it's such an individualized thing, depending on the extent of your surgery. So don't be discouraged when you're looking at other people, comparing yourself to other people based on their progress, because quite frankly, it's really out of your control, and it really depends on the surgery, what has to exactly get repaired, and then how your body responds to that surgery. So without further ado, these are some of the exercises I've been doing. And finally, just to wrap up, after seeing some of those exercises, I'll continue to make these videos and update you guys on my progress, specifically when I'm back and getting to run a little bit again. I think that'll be hopefully in the next, fingers crossed, 3 to 5 weeks. I'm hoping from now that I'll be able to really get the ball rolling on that. So I'll keep you guys updated on that. As always, like, subscribe, leave a comment, ask a question. Happy to answer anything about my experience, and just looking to help everybody out by providing information about my experience. And I don't know, you guys are all watching, considering having the surgery, going through the recovery right now, whatever the case may be. We're all here along for the ride, so keep going, keep pushing, stay positive every day, and get better every day. Thanks, guys.